Hello students, in today's lecture we're going to cover Module 4, which is focused on maternal health. However, towards the end of this lecture we're also going to cover some content on paternal health as well. So overall, I like to call this module maternal and paternal health. However, the majority of the issues are going to focus on maternal health. Started with our content for today. So as I said, we're going to talk about maternal health majority of the lecture. And I would like to begin that with focusing on some of selected women's reproductive health issues. And it's really important because in order to get better understanding of maternal health, we must actually first talk about women's reproductive health issues. And actually, good reproductive health protects a woman from infections and allows her to heal from injuries. But in order to really maintain your health, making healthy choices is really important from the beginning. And we're talking about from a very early age, right? When you hit that stage of puberty and making sure at that point and on you're making choices that are healthier for your body. And when you really take care of yourself, it also means that you're taking control of your health, right? And this brings us to this term that is very, very important for this lecture, and it is known as preconception health. Preconception health basically refers to this idea that the health of women and men during their reproductive years, which are the years they can have a child, are of high importance. Preconception health is also beneficial in the case of an unplanned pregnancy to provide the baby with a protected womb. It focuses on taking those steps now to protect the health of a baby rather than in future, even if it's unplanned. I'm going to give you an example. So physicians recommend that women in their reproductive years should take actual prenatal vitamins or supplements regularly, even if they're not planning to get pregnant anytime soon. Why? Because it keeps the body nourished and prepared in case of an unplanned pregnancy. And you may say, well, what's this whole fuss about the unplanned pregnancy? The reason is there are compelling statistics that support preconception health. Remember, no one expects an unplanned pregnancy, but nearly half of the pregnancies that occur in the United States are unplanned. So that kind of really tells you the importance of maintaining good preconception health throughout the years as you go. And again, it's also very important. It's important for every man and women specifically, because it's not just for those planning pregnancy. It means you're taking control of your health and choosing healthy habits early on in life. So this basically summarized everything that we went over in the previous slide. An example, basically stating the statistics and how it supports the preconception health. An example of how physicians nowadays recommend that women do take supplements and vitamins even if they're not planning to get pregnant anytime soon, and the overall importance of maintaining good preconception health. After we talked about the concept of preconception health, what I want to do is choose a few selected topics of women's reproductive health and focus on those. And again, these are based on research on something that is of high importance, something that needs to be addressed in a health-based course. So the first topic that I've chosen is the usage of contraception or birth control. Now, what exactly is contraception? It is used to prevent unintended pregnancy, and there are several safe and highly effective methods of birth control. I mean, I have included some of those examples here. Note that there are several other examples. And so, for example, intrauterine contraception, hormonal and barrier methods, permanent birth control, sterilization. These are very few of the options that are available from a wide variety of options. And with contraception, it's very much of a trial and error. One woman's body might respond to something really well and might not respond to something else really well. So you just really have to pick and choose and try it and see if it suits your body well to be able to continue with that particular contraception option. Followed up with depression and then symptoms of depression, so a mental health illness. During reproductive age, during reproductive age period of a female, depression is actually very common. In fact, things like trying to get pregnant, being pregnant, postpartum depression, all of these are contributing factors for developing symptoms of depression. The issue with depression is that many women don't really know what the symptoms are when they're experiencing depression. So other life events can become risk factors as well, such as like losing a baby or having trouble getting pregnant. And the first step towards really getting better and improving your mental health status would be to talk to someone, schedule an appointment with a healthcare provider, state all the feelings, all of the things that you've been noting about yourself, about your emotional health, your mental health, and basically logging them into a chart and making sure to mention those to a healthcare provider. And then perhaps asking for a referral to a therapist or a mental health practitioner. Because talking about your emotional state is the single biggest positive step in restoring your mental health, and is often the hardest step. So making sure, I encourage all my students from all walks of life to making sure if there is anything remotely like that going on in your life, to make sure to seek a health professional and talk about those things. And so the next topic that I would like to focus on in women's reproductive health is infertility. Now, what exactly is infertility? It means not being able to get pregnant. However, there is a timeline associated with it. So in general, when we talk about infertility, it means not being able to get pregnant after a minimum of 1 year of trying. However, if a woman is 35 or older, infertility is actually based on a 6 months trying period. And this category actually includes women who can get pregnant but are unable to carry the baby to the full term, or women who are unable to conceive to begin with. So it includes both of those categories. Now, statistically speaking, about 10% of the women in the United States, which marks about 6 million figure, between the ages of 15 to 44, have difficulty getting pregnant or staying pregnant. So infertility, the good news is that we have infertility treatments. They're definitely out there. Research and science has produced some successful results. The bad news is that it is very, very expensive. So we definitely could have some work done in order to make them more affordable. The next topic we have in women's reproductive health is hysterectomy. And hysterectomy, I wanted to keep it very simple. However, it is something, statistically speaking, of significance that we should definitely mention it in one of our top 5 reproductive health topics. And hysterectomy is the surgical removal of a woman's uterus. And this is the area, the lining of the uterus in which the baby grows when a woman is pregnant. Hysterectomies are very common, in fact. 1 in 3 women in the United States has had one done by the age of 60. So our next topic, our 5th topic in women's reproductive health, is menopause. And again, I would like to also keep this topic very, very brief. First of all, what exactly is that? I'm sure everyone is familiar, but menopause, just to describe it, is a normal change in a woman's life, and this is when her period, her menstrual cycle stops. And a woman has reached menopause when she's not had a period or a menstrual cycle for a consecutively 12 months period, and it often happens between the age span of 45 to 55 years of age. There are several other topics that are reproductive health concerns in women, and I wanted to sort of give you a very brief list of those, including endometriosis, uterine fibroids, gynecological cancer, HIV and AIDS, interstitial cystitis, polycystic ovary syndrome, sexual violence, sexually transmitted disease. However, I have a little bit of homework for all of you. What I want you to do is, for each one of these, I want you to find a 1 to 2 line description for each diagnosis. This makes a very good exam question where I could easily ask you for a definition, or perhaps I could give you a diagnosis and ask you to define it, and it could be one of these. So make sure that you go back and do that homework where you're able to find a 1 to 2 line description for each of these diagnoses and add that to your notes. We're going to go ahead and move on to the maternal health concepts. And based on research, I've picked out 3 specific maternal health concepts that we're going to focus on for our lecture today. Those 3 topics are pregnancy complications, substance abuse, tobacco and alcohol specifically, during pregnancy, and the reasons for pregnancy-related mortality. So let's look at some of the pregnancy complications. Again, there's a list of items and a list of topics that I would like to go through as far as pregnancy complications are concerned. The first one being anemia. So during pregnancy in general, a woman's body actually goes through several different kinds of symptoms and alternations, which can cause, annoying discomforts to some illnesses. Let's talk about anemia. So anemia is having lower than normal number of healthy red blood cells. You could treat the underlying cause, and that could help restore the number of healthy red blood cells. And that is usually what the treatment protocol is for any woman who is anemic during pregnancy. Pregnant women who have anemia, they often feel really tired, they feel weak. This can be helped by taking iron or folic acid supplements, making sure that you have a really healthy diet, proper nutrition, and then perhaps supplementing that healthy diet and nutrition with supplements, and that occurs very commonly in a lot of anemic pregnant patients. Something in particular that I wanted to talk about, that anemia or lack of iron often causes this craving for foods that have actually no nutritional value. And this diagnosis has a term. It's called pica, where a mother would have a craving to eat foods like chalk or dirt or crushed ice and clay. Crushed ice being a very common one. And again, it is foods of no nutritional value, but there's a craving due to the lower levels of iron and folic acid in your body. You have cravings of eating foods that are of no nutritional value. The second topic that occurs very commonly during pregnancy and is often considered a pregnancy complication is a urinary tract infection, or a UTI. And a UTI is a bacterial infection that occurs in your urinary tract. And you may have a UTI if you have a pain or burning sensation when you use the restroom, if the urine smells really foul in odor, looks cloudy or even reddish, so it has tints of blood in it. And the treatment is usually done with a simple course of antibiotics. However, recognizing that is very important in a timely manner, and oftentimes UTI infections occur with recurring high fevers as well. So that is something to also note if that is occurring in a pregnant woman. Then we're going to go ahead and focus on mental health conditions, and again, the focus will be symptoms of depression and anxiety. But let's go ahead and look at those in a bit more detail. So as far as mental health conditions are concerned, symptoms of depression is the single most common mental health condition that occurs during pregnancy. And some of the symptoms that are very common specific to pregnancy are like having a low or a sad or a very down, low energy mood, loss of interest in things that usually were fun for you before, followed with changes in appetite, having a lower appetite or having a really high appetite, up and down sleep cycles and energy. And when many of these symptoms actually occur together and have lasted longer than a week or even 2 weeks at a time, that is probably a best time for seeking a healthcare professional's help and giving a proper identification to all of those symptoms. Oftentimes that is the onset or the mark of when depression has been identified in a patient. It is also important to note that depression during pregnancy is a strong risk factor for maternal postpartum depression that will follow up. So it's important to identify and create those links to making sure you're aware of those and are expecting those, just to make sure that you are prepared. And depression that continues during pregnancy may make it hard for a woman to care for herself and for her unborn baby. So being aware of that really helps making sure that the mother and the child are both taken care of and are getting the treatment that they seek and that is necessary for their survival. The next pregnancy complication that I wanted to talk about was obesity and weight gain. And when we talk about those topics, as far as description is concerned, obesity and weight gain both are associated with high levels of weight gain that can actually complicate the pregnancy by putting the mother at a very, very high risk. It can also complicate the child's health by putting the mother at risk for preeclampsia, gestational diabetes mellitus, a stillbirth of the baby, or a cesarean delivery. So basically what happens is you have started to see a trend here, right? That having one of the pregnancy complications kind of puts you at a risk for many of the other consequences that we mentioned here. And the best way to avoid them is to carefully monitor your health during this time and to make healthy choices during pregnancy, and not just during the last trimester, actually before you even try to conceive, making sure that you are in those healthy habits early on. You're taking supplements, you're taking vitamins, you have a healthy diet, you're working out, you're doing exercise. All of those habits puts your body at the perfect place, so when you do go ahead and conceive, your body is kind of set up in the right tone and in the right environment and the right habits for that baby to grow in. In order to discuss the topic of substance abuse in pregnancy, I selected these two educational videos. Both of these are going to be on the exam. In order to understand the concept of substance abuse in pregnancy, I require that you take a look, and view those videos in detail. Make sure to take good notes, as I will be asking you a question specifically from them. And that is all I would like to say about substance abuse in pregnancy. I'm covering those in very brief detail. I'm covering those very briefly. They're not in depth. However, whatever content that is covered here will be on the exam. So make sure to view that. This brings us to our next topic, that is of severe maternal morbidity and during pregnancy. And what exactly is morbidity? So the most severe pregnancy complications, such as heart attack or hemorrhage, actually contribute to what is known as severe maternal morbidity, SMM, and that is the prevalence of disease. Every year, SMM affects about 65,000 women in the United States, and this number is increasing. Now, 65,000 may not seem like a lot, but based on the kind of healthcare infrastructure we have, the advanced technology we have, that number should be nearly close to zero. And the fact that it's not close to zero tells us a lot about how we're lacking and things are slipping through the cracks. So we need to improve those in that area. In fact, from 2000 to 2010, maternal morbidity had actually increased significantly, leading to higher direct medical costs and extended hospital stays for mothers. Public health practitioners have studied the pregnancies in the last decade, and they found out that a combination of factors that have contributed to it. What are those factors? It is including increase in mother's age, so maternal age, pre-pregnancy obesity, pre-existing chronic conditions prior to conceiving the child, cesarean and other complications during delivery. So a multitude of those reasons have increased our maternal morbidity rates, SMM. And basically having a control over that can definitely improve the outlooks and the consequences. Now let's look at maternal mortality. What exactly is maternal mortality? And what can we do to prevent a pregnancy-related death? So maternal mortality is pregnancy-related death. The question to ask here is, what can we do to prevent a pregnancy-related death? It's the death of a woman during pregnancy or within 1 year of, so a pregnancy. All right, so let's look at maternal mortality. What exactly does that mean? Maternal mortality means pregnancy-related death. However, the question to ask here is, what can women do to prevent that? A pregnancy-related death is defined as the death of a woman during pregnancy or within 1 year of the end of pregnancy from a pregnancy-related complication. So it does not necessarily have to occur during pregnancy. It could occur in the year after pregnancy as well, but the reason has to be tied in with delivery or pregnancy in general. Now, the problem is that even with our modern technology, healthcare infrastructure, and advanced medical system, we still have about 700 women each year that die as a result of pregnancy or delivery complications. And the rate of pregnancy-related deaths in the United States has actually increased over the past 25 years. It started to level off in the recent years, but it has again spiked again. And 1 in 4 pregnancy-related deaths are actually due to heart conditions. The other causes for pregnancy-related deaths include infections like flu. It includes bleeding, blood clots, high blood pressure, and of course, there are some groups that are at higher risk. So we've talked about high-risk groups, right? Women between the age of 35 to 39, they're almost twice as likely to die of pregnancy-related complications compared to women from the age of 20 to 24. Now, the risk becomes even higher for women aged 40 and older. In the same way, we have ethnically related correlations here. So African American mothers are 3 to 4 times more likely to suffer from pregnancy-related complications than Caucasian American mothers. So there are several scenarios here to consider when we talk about maternal mortality, and not all of them are related to physiological conditions of the body. We have definitely ethnicity that plays a role here. We have age disparity that plays a role here as well. To adopt a healthy lifestyle, and again, that whole concept of preconception health and making sure that you're maintaining good preconception health in all of your reproductive years, and that you're especially in good preconception health at the time you're thinking about conceiving, should it come planned pregnancy, and this being in a general practice, even if it is an unplanned pregnancy. Followed up with early initiation of prenatal care, making sure that you go to those doctor visits early, that you are very regularly going, that you're not missing appointments, you're not rescheduling from time to time, and that you're really taking care, you're really initiating and maintaining that prenatal care. Early recognition and management of complications. So if there are any health-related complications or any chronic conditions that you suffer from, that you may or may not be aware of, making sure that you recognize those early. And I understand that it may be difficult because some of the things we recognize as we go along the path. However, if you are aware of those, making sure that you manage those in a nice way so that it does not interfere with your pregnancy and does not complicate your pregnancy further. And lastly, visiting your healthcare provider and their recommended and the scheduled time, and making sure that you stick to that schedule, making sure that you do go at the scheduled visit, and making sure that you do everything that they're asking you to do to make sure you're taking care of yourself and the child. And that sums up our content on maternal health. Now we're going to go ahead and take a look at paternity. Again, we're going to go not in a lot of detail. It's going to be very brief, and the reason being this topic is still very new. There's limited research on it. The research is growing, and we're finding out some very unique and interesting things about paternity and paternal health. However, the topic is still very new. But a growing body of research on paternity suggests that a man's diet, drinking, smoking, and age can actually contribute to having birth defects, autism, obesity, mental illness, and even some of the other problems in their kids. That tells you that the man's age and lifestyle definitely has a direct effect on their child's health, and that the mental stability of the father as well directly has an effect on the health of not just the mother, but also the child. There was a really interesting study that was done that talked about 3 components of paternal health. What I want to do is first talk about those components of paternal health in this slide, and then talk to you about the study. So the 3 components of paternal involvement are interaction, availability, and responsibility. Interaction includes all levels, such as physical, emotional, mental, and social. So examples could be, playing catch, or playing with dolls, or, having princess tea parties, engaging in that social play. Fine. The second is availability, which is being around for that potential interaction. So being in physical contact so that you are able to engage in and you are able to interact using the first component. You're able to interact within those available opportunities. And then the third one is responsibility, which is caring for the needs and providing those resources. And with men, we often associate the term provider, and a lot of times that term is associated with this responsibility of a father figure to provide the needed resources for their child and for their family. Now, in this particular slide, we talked about the 3 components for paternal involvement. Like I said, next one, let's talk about the study. So there was a study known by the name of the elephant study, where they looked at a group of elephants in a reserve. The group had male adolescents, females, older females, and older males. What the scientists did is they moved the adolescent males and females and older females to a new area. So the only group the only subgroup that was not moved with them was the older male elephants. And what they started to do was observe the behaviors in the new subgroup, which comprised of the adolescent males, females, and the older females. And what they saw was aggressive behavior that started to take place and rise in the male adolescent elephants. So that took place for a little while, and what they did then afterwards is they reintroduced the older male elephants to the population group. So now the entire group was complete with older males and females and adolescent males and females. But as soon as those older male elephants were reintroduced back into the group, they saw that the aggressive behavior in the adolescent male had stopped. That study kind of reinforced the idea that father figures have a direct impact on younger males. And that concludes our content for this